is Maya, and I'll be your student registered nurse for today. According to your notes, it says you're due for some morphine for your pain.
That is correct.
How's your pain right now on a scale of 1 to 10?
Oh, it's a 6 out of 10.
Okay, so I'll get some morphine for you. Just before I do, I'm going to confirm some details if that's alright with you.
Sure thing.
Would you tell me your full name and your date of birth, please?
Yep, no problem. My name is Dobson Kane. Yep, and my date of birth is the 31st of the 3rd, 1994.
And the MRN is 0956742. Do you have any allergies, Kane?
Yes, I do actually.
What are you allergic to?
I'm allergic to penicillin.
And what happens when you have penicillin?
My face starts to swell.
Okay, so we'll just make sure there's no penicillin in your medication. Alright, I'm gonna get that medication ready for you, but if you need anything, I'll give you the buzzer and you can buzz and just let me know, and I'll be back soon. Could you help me validate my medication order?
Yep, sure thing.
Here we have Kane Dobson. His date of birth is the 31st of the 3rd, 1994. His MRN is 0956742, and his armband matches his patient details. We have the right patient. He is allergic to penicillin and he gets a face swelling reaction. Dr. signed and printed his name. Is also wearing a red armband to indicate this. For today's date, 28th, he's due for morphine hydrochloride trihydrate. The route is per oral. Dose is 7.5 milligrams. The frequency is 6 hourly. Time is now has not been given. The indication is analgesia. Doctor signed and printed his name. It's a legible order and it's within 7 days. Do you agree?
I agree.
Okay. Morphine hydrochloride is used as an opioid analgesic for the relief of severe pain. Contraindications include opioid hypersensitivity, gastric emptying, and severe liver and renal dysfunction. Adverse reactions include GI upset, constipation, and sweating. And the therapeutic dose is 5 to 20 milligrams every 4 hours. In consideration for my patient is that I will check his vital signs before and after I administer the medication, just to make sure that his respiratory rate is within normal limits. Okay, Irene, I'm just going to open the drug cupboard and get my morphine out. Morphine. And I'm just going to check the balance. So the last amount given was 1.5 mils, and the balance in the bottle should be 37.5, which is correct. Here are my equipments, and now I'll do my first drug check. Okay, nurse, would you help me do my first drug check, please?
Yep, sure thing.
Okay, so here we have Kane Dobson. His date of birth is the 31st of the 3rd, 1994. His MRN is 0956742. The details match the patient's armband. We have the right patient. He's allergic to penicillin. His reaction is a face swelling. Dr. signed and printed his name, and he's also wearing a red armband to indicate this. For today's date, which is the 28th, he's due for morphine hydrochloride trihydrate. The route is per oral and the dose is 7.5 milligrams. The frequency is 6 hourly. Time has not been given. The indications for analgesia, Dr. signed and printed his name. And here I have morphine hydrochloride trihydrate. It's a 100 ml bottle which expires on the 12th, 2023, and it's for oral use. Do you agree?
I agree.
I'm just going to do my medication calculation. So the dose required is 7.5 milligrams, and the stock strength of the morphine is 5 milligrams times 1 ml over 1, and that is 1.5 milligrams per ml. That's the calculation. So I'll be drawing that up into a syringe and giving it to the patient orally. Could you help me do my second drug check, please?
Sure thing.
Okay, here we have Kane Dobson. His date of birth is the 31st of the 3rd, 1994. His MRN is 0956742. The patient's details on the medication order match his armband. We have the right patient. He is allergic to penicillin and he gets a face swelling reaction. Dr. signed and printed his name. He's also wearing a red armband to indicate this. For today's date, which is the 28th, he's due for morphine hydrochloride trihydrate. The route is per oral and it's 7.5 milligrams, which is the dose. The frequency is 6 hourly. Time has not been given. The indication is analgesia, and the doctor signed and printed his name. And here we have morphine hydrochloride trihydrate. The expiry date is December 2023. It's a 100 ml bottle and it's for oral use. And as per my calculation and the MIMS, as per my calculation, he used to have 1.5 mils drawn up. That's 1.5 milligrams. Do you agree?
That is correct.
Morphine hydrochloride trihydrate. Do you agree, nurse?
Yes.
Okay, nurse, would you help me do my third drug check? Okay, so here we have Kane Dobson. His date of birth is the 31st of the 3rd, 1994. His MRN is 0956742. The details match the patient's armband. He's also allergic to penicillin and he gets a face swelling reaction. Doctor signed and printed his name and he's also wearing a red armband to indicate this. For today's date, which is the 28th, he's due for morphine hydrochloride trihydrate. The route is per oral and the dose is 7.5 milligrams. Frequency is 6 hourly, time is down, has not been given. The indication is analgesia. The doctor signed and printed his name. And here I have morphine hydrochloride trihydrate. The expiry date is 12/2023. It's a 100 ml bottle and it's for oral solution. And as per my calculation and the MIMS, he is to have a therapeutic dose of 1.5 mils. And here I have 1.5 mils of morphine hydrochloride trihydrate ready to go in the syringe. Do you agree?
Agree.
Okay, that's it. Okay, nurse, would you help me do my third drug check? Okay, so here we have Kane Dobson. His date of birth is the 31st of the 3rd, 1994. His MRN is 0956742. The details match the patient's armband. He's also allergic to penicillin and he gets a face swelling reaction. Doctor signed and printed his name and he's also wearing a red armband to indicate this. For today's date, which is the 28th, he's due for morphine hydrochloride trihydrate. The route is per oral and the dose is 7.5 milligrams. Frequency is 6 hourly, time is down, has not been given. The indication is analgesia. The doctor signed and printed his name. And here I have morphine hydrochloride trihydrate. The expiry date is 12/2023. It's a 100 ml bottle and it's for oral solution. And as per my calculation and the MIMS, he is to have a therapeutic dose of 1.5 mils. And here I have 1.5 mils of morphine hydrochloride trihydrate ready to go in the syringe. Do you agree?
Agree.
Okay, that's it. Back into the drug collection. Nurse, would you sign the
Sure thing.
drug book? Okay, and just before I give the morphine to you, I'm going to confirm your details one more time. Would you tell me your full name, please?
Sure thing. Bear with me. My name is Dobson Kane,
And your date of birth?
31st of the 3rd, 1994.
Okay, and the MRN is 09, so it's Kane Dobson, date of birth is the 31st of the 3rd, 1994, and your MRN is 0956742. And what are you allergic to, Kane?
I am allergic to penicillin.
And what happens when you have penicillin?
My face starts to swell.
Okay, that's fine. There's no penicillin in this. Okay, and just before I give you the medication, I need to let you know that you might experience some some stomach pain, and some constipation. But if you do, you can press the buzzer and let us know, and we can come sort that out. Okay, Kane, I'm just gonna sit you up so I can give you the medication comfortably. Is that comfortable enough for you, Kane?
Yes,
For the
yes,
medication?
that's perfect. Thank you.
Alright, so here's your morphine and a bottle of water. I'll assist you with that. So that's your morphine, and here's your water. Okay, Kane, so that's all done. I'm just gonna come back in about 15 minutes to make sure everything's okay, and I'll do a set of vital signs on you to make sure your respiratory rate and your vital signs are still fine. Here's the buzzer if you need anything. Please press it if you let me know, and I'll be back in 15 minutes. Can I get anything for you now?
No.
I'm gonna discard my medication now.
Guys,
Sound that for me, nurse, please.
Sure thing.
Thank you.
Here we are, no problem. Hold on.